Cool.
Let's do it.
Let's go.
Let's go. We're good.
Right, cool.
So welcome back to RMC. Took a little bit of a hiatus. I was busy here. Are you busy at work?
Staying busy everywhere. Yeah.
Staying busy in and out of the office.
You got married.
I did. I did get hitched. Shout out to Sarah.
It was a fun wedding. Had a blast.
Yes.
Took my shirt off. It was everything I wanted to do.
That's true. Sam wasn't invited.
Sam,
I didn't want to go anyway. Let's get on with it.
that's so bad. But anyways, topic for today. We got no one other than the three of us, and we're just going to talk about pain. So differentiating between, from an athlete standpoint, from a provider standpoint, let's just start it off. Who wants to kind of just depict or define what pain is?
Yeah, well, we talked about first defining it just because that's important, obviously, for the discussion. So to keep it all within 30 minutes here, way less than that. Pain is super complex, and I think that's one factor of it that a lot of people don't understand. Especially a lot of athletes think that if something is sore, maybe off or painful, whatever word you want to use for it, that means that there's like harm to their body being done structurally, something like falling apart, tearing, whatever. And I think people maybe don't realize as much how many different factors play a role, like sleep, nutrition, stress, things outside of your sport, just how your relationships with whoever, all that adds up. But point is there's a lot of different factors that can play a role.
When I think about pain, like what is pain? And when I talk to patients in my office or just talk to people, pain is a signal that something needs to change. It doesn't necessarily mean there's injury. It could mean there's just something, whether it be you need to recover more, you need to sleep more. Didn't get it. But it's a signal that from your body to your brain that something isn't acting or moving as it should, and that requires change. Whatever that change is depends on the scenario, what's actually affected. But when I boil it down to my brain, because it is complex, where people have hour-long lectures on the pain science and how psychology plays into it and so many things.
Well, then you got to think about neurology too. Like you put that in the aspect. I guess we're just talking specifically about physical pain more so. So sorry, I butted in.
Well, but I mean that's part of it. Like your brain controls how you feel, right? So that psychological pain will impact the physical pain of this and your mindset towards it. So without going down those rabbit holes necessarily,
that'd be a fun rabbit hole to go down.
Truthfully, I'm not an expert. It would be. You might be able to be more an expert on that, but the actual science and neurology of pain, I will stay in my lane and be that's not necessarily what.
I certainly wouldn't call myself a neuroscientist. We cover a fair amount of that in school, and there are areas of training, but in general, I would describe it to kind of keep it simple and digestible, that our bodies are highly adaptable, and so like you said, the initial signal of something needs to change. For some people, that that change doesn't happen quickly enough or soon enough, and essentially the nerves become more sensitized, so they get used to this signal that's being processed by the body that the brain perceives as pain, and over time, then we get more. Essentially, the nerve endings become more sensitized to that, and we feel now all of a sudden the pain is spreading, and now other things that weren't painful before, now they are painful. So I kind of, for my patients, will describe it as, there's a lot of different analogies, but I like to keep it simple as like a fire. So the initial injury is where the fire started, and then over time it just kind of spreads. And then you have to decipher, how do we contain it, right? Is it a matter of training? Is it a matter of nutrition, sleep, whatever? That's the part of the clinician that, the skill comes in. But point is it's very complex. I think a lot of people don't appreciate that. It's not always super simple.
No, it's not cut and dry. Yeah. And I don't think it'll ever be cut and dry. But from the standpoint of obviously breaking down the science point is awesome. But from a Joe Schmo, whether he's in here or not, right? I send him to either of you. Let's go down the path of how would you initially screen, or we'll go screening first. What's the screening process for an injury on both standpoints, from chiropractic or physical therapy?
You want to go first?
Sure. I always be polite here too. So with every patient, the first thing is going to be a subjective, obviously. We have to talk together. We have to decipher, what's when I talk to students about this or residents, I'll talk through, like, you want your subjective to essentially tell the story, right? Paint the picture, if you will. I need to know, like, when did this pain start? What are maybe some of the preceding events that led up to that starting? And then what has gone on in each chapter of the pain starting up until when you're with me right now. So for me, that gives me a good, clear indication of everything that led up to it that may be contributing to the nature of the pain. So if somebody says, for example, I know we'll get into this topic too, if somebody says, oh, I'm my quads are tremendously painful, okay, tell me everything that happened. Well, 2 days ago I did 1,000 squats. Okay, I'm much less concerned compared to if they said, oh, it's been going on for 6 months, years, whatever. So for me, it just boils down to, let's have a good detailed conversation of what is everything that factors into when this started compared to where we're at now.
Yeah, I mean, the subjectiveness for the consult and really understanding what's happening is super important. So it starts there, and then when it comes to the examination, obviously it depends on what they got going on, right? When it comes to what we're going to be even looking at. As a chiropractor, I'm always going to be looking at the spine because that's just the bread and butter. But when it comes to other joint functions, if I need to look at knees, hips, ankles, but try to look at, at least from my perspective, the whole picture too at the same time. And so when it comes to specific tissue, like grading the quality of that, are there adhesions, or the muscles not moving the way they should, or when it comes to the joints, how is the joint moving? Is it fixated? And there's a couple of names you could go by that. You could call that facet syndrome, you could call it fixation, you could call it subluxation, you could call it so many different things. But I'm really trying to both look at the quality of movement of the joint as well as the tissues around it and look at the whole picture. But me, I definitely see more general population, not just athletes like in here. So it is, I think, Gen Pop versus, everyday people versus non-CrossFitters, because we're all in CrossFit gym, athletes. It is a little bit different because chances are they have been dealing with pain for years, and if you have a condition for years, it's a little bit different than I did 1,000 squats 2 months ago or a week ago. It's a little bit different. And you probably see that when at some of your practices when you look at Gen Pop versus athletes. I know you practice in a couple different spots.
Yeah. Like I said, all of that boils down to the subjective. I mean, the patient is the only one that can obviously give you that insight of, how did we get to where we're at now. So you just have to ask the right questions. But I'd be curious, actually, from your perspective as coach, because really you are almost like the first line responder. You're going to be the first person that somebody talks to.
As the liaison for any individual that comes into a fitness setting as I'm hurt, right? That's everybody's hurt. Let's put it that way. Everybody's walking around with a shoulder impingement or some sort of pain in their shoulder. Someone always says that their hip hurts or their knee hurts or their ankle hurts, and you just run through every joint. So the biggest thing that I'm thinking about is, again, like you said, what'd you do yesterday? Like, truly, that is the first question. What was the causing root of it? Because I'm seeing you for 45 to 60 minutes, vigorous activity, maybe, and we're going to go through a series of different activities, but right when you leave, what are you doing? Like, that's my biggest question, is what did you do outside of the gym that could have caused the things that we did to give you that numbness, sharpness, dull, whatever it could be in that region that's causing you an issue. So like the first thing that I'm always asking is, what did you do? And then from there, then I'm going to tailor it back to depending on what we're doing in the session for the day, what we have to completely avoid, or what can we push. I don't even want to say push because don't want to think like I'm pushing you over the edge, but what can we do that's going to aid in a stability point for it rather than completely just removing it from the objective for the day. Because when you go for rehab, right, or prehab or whatever you're going to do, we're going to have some sort of activation point, some lengthening point, and then you're going to go through some action of let's try to strengthen this thing back down. And truly on a broad stroke, that's what I'm trying to do as quickly as I possibly can, so we're not taken away from the other individuals in the group. So it changes from person to person for sure, but I always think it's outside the gym, and that's just my personal opinion, but it is
probably a lot of it is. I mean, like we talked about, there's a lot of other factors. That's why I get the question all the time of, people will say like, oh, I have pain now all of a sudden, but I haven't changed any of my activity or been going to the gym still, I'm not just sitting on the couch all day, like why is this happening now? And if I had the answer to that question all the time, be a billionaire. So it's
For real.
it's the golden question. Everybody wants to know, like, why pain right now? And I don't think science has answered that. We may never, but we have some good indications of what are the factors that we can control to reduce the chance of it, progressing or happening in the first place.
Yeah, and the beauty of like what we do, right? The three, as you guys as practitioners, and myself being able to see, I have contact point with out of the 365 days, 315 days a year minimum, 6 days a week, 52 weeks in a year, right? Rough math, I think I did that right. But I'm seeing them all the time, right? An average goer is coming 4 days a week, 3 days a week. So if I have an issue or something like that, I suggest, hey, go talk to Garrett or Sam, and then they can relay stuff to me where either we have to completely remove something or work through a certain range of motion so that we can keep both what we're trying to do as in the clinic to get you back to full health, but I can also aid in the whole process the entire way, so we're strengthening it, right? And that's what we're trying to do. So, I mean, it's important.
A lot of times I think about it as, the straw that breaks the camel's back. Like what is that? Often we don't know, but I like to think about it in 3 dimensions of, if there's our physical stress, this is an easy example, being in a CrossFit gym or just even doing normal things, going up the stairs, making breakfast, making a salami sandwich. That's very specific.
I was going to say, did he have a salami sandwich?
No, there was a friend who threw out their shoulder because they were making salami sandwiches for their kids, which I thought was very funny. I know. Anyways,
not using the right meats.
And this was a friend I would know. Anyways, so there's physical stress, but then biochemical, and then like psychological, right? So biochemical, foods, nutrition, the air we breathe, the water we drink, the water we don't drink, and then psychological is whatever is going on in the head space. Chemistry, there's so many things, just psychology. Those 3 things will lead to stress in the body and something, because I hear it every day as well. I didn't do anything. I woke up like this, and I don't know what you did either, but the straw that broke the camel's back, maybe it was, maybe your cover in your bed was like 300 pounds and you were lifting it and that threw your back out, or maybe your cover is your cover and you had stress building over time and you haven't addressed issues, that you've had in compensation patterns. So it just depends.
When people come in and they're like, I think I slept wrong. It's like, well, do you sleep on your back? You sleep on your side? You do X, Y, Z? And it's we're doing a press overhead today. And they're like, yeah, I can't put my hand above my head. It's like, you probably slept and then twisted and rolled all over the place. Well, of course. Let's try to use some pillows to your advantage and stop laying with your spouse on top of your arm and all that good stuff.
Yeah, I always think that point is interesting too, because something else that's probably under paid less attention to than it deserves is our beliefs, and we all have them, of course. Even being a practitioner and knowing the effects beliefs have, I have my own biases. And I think it's important for patients to recognize too that, something that you believe may be the cause of the pain, it may be contributing to that because that's your belief. And not that our job as practitioners or coaches is to change your mind, do some psychological tricks, but it's always interesting to me when people are like, oh yeah, I think it was this very light exercise that did it. Meanwhile, the rest of their life is not really optimal for pain management. And so then you have the conversation like, okay, maybe there's some other things too, but that's always an interesting process too of really navigating the belief system, because that's important for sure.
So that might be like a great point in transition of talking about soreness versus injury, right? Especially in context of fitness and working out and athletes, right? But as a gym owner, how would you define an athlete versus a non-athlete?
I mean, traditionally, speaking from the standpoint of CrossFit, right? Anybody that walks through our door is considered an athlete, because what we're doing is we're taking a strength and conditioning protocol and we're doing it for an everyday lifestyle, right? We're trying to be functional for the unknown and the unknowable, which is life, right? So the definition for what is an athlete, broad stroke, it's anybody that is doing vigorous activity or some sort of activity, I would say.
Okay, so the conversation of soreness versus injury in the context of an athlete is vigorous activity in some kind of capacity.
I mean, that's what sport is truly, right?
Cool.
Like you think about it in from any sport. A wrestler is, how do you define a wrestler? Like, tell me that.
A ref says go.
Yeah,
well,
you just
shake hands and then you
shake hands, and then who can hip toss a kid over the other the other person, right? Or hockey, baseball, any rotational sport, any running activity. Like, you think about it, who is a runner? Well, individual that goes for a run.
Right.
Right. That's just
100%.
kind of how it is. So I mean, soreness versus injury. That's when, okay, you have something that's clearly broken or torn, or something that an image can pull out. But a soreness, it could be anything from, again, I did a couple hundred repetitions and now I feel like I can't bend over because my legs are just torched. Well, you're sore. Welcome to the club. You finally figured out that is what muscle engagement should feel like.
Right.
Right? And that's what we're doing.
Yeah, I think it's important, especially if you're new to the gym or you're just getting into some form of activity, it's important to appreciate that. I mean, anytime I'll put together an exercise program, I'll kind of give my patients a warning, okay, we could potentially have some soreness like a day or two after starting this because it's new. As long as it doesn't create, sharp pains or things like that, it probably will go away soon. And just priming them to understand, like, okay, that's okay if that happens is huge, because if you don't do that, then that's when some of the negative thoughts come into play, and that can, deter them from, rehab, chiropractic care, or the gym too, right? They might get sore the first day they try out CrossFit and then be like, oh, CrossFit's bad for me. Like, no, this is normal biology. Like, stick with it and it goes away.
Right.
So that's a huge part of it.
Like, as an athlete, like, even myself, like, I get sore, and like majority of the time I'm sore. It's really weird when I'm not sore,
You live sore.
Yeah, you live sore, and then that's when you jokingly ask yourself, why do I do this again? But you know why. But for somebody just getting started, like you said, if they don't know about that or if they don't have a warning, that could be a pretty shock to the system. But when you're then always sore because you're always challenging yourself and trying to make yourself better, then the question is, it gets a little bit more dicey. Am I sore or am I injured? And I think that's where a lot of people try, like, it's hard. You need experience to really be able to understand the answer to that question.
Yeah.
So
question for both of you. I mean, all three of us can answer it, but what are like attributes that you would describe as pain versus sore? So let's start with, what would you describe something as sore?
Yeah.
Like, what would be anything? Words, statements, how would you describe it?
There's going to be some overlap probably, like with each characteristic. Like, for example, I give the idea of delayed pain. So if it's a day or two after the workout, that by itself could be pain or soreness, but a lot of times it's going to be soreness related. So,
But wait,
for me,
what is soreness?
soreness? Well,
Like, just
saying just the definition. Yeah.
I'm coming to you and I don't know how to describe this in my leg.
Yeah.
What would you
Well,
say?
I mean, if you want to get down to like the nitty gritty, like there's chemical buildup within the muscles that's going to stimulate the soreness feeling. So, I mean, truly, if we took a biopsy of your muscle fiber, we're going to see things in somebody who's, let's say, having a sore. Let's just pick the quad because it's big and easy to think about. We're going to see things differently, like under a microscope, for that person compared to somebody who didn't just work out like 24 hours ago. So there are like true chemical changes, structural changes. It's not like it's just all in your head, but a lot of it is psychological too. So, for example, if you feel something like maybe at the start of the workout feels a little bit tight or uncomfortable, but goes away after you warm up, very good sign, keep going. Versus, it's getting worse throughout the warm up and the rest of the exercise or the workout, and now I'm like compensating my movement. For me, that's a big indication that, okay, there's probably an quote unquote injury that's going on. If you can't even move normally, that's probably not just normal soreness. There probably could be a true injury there. So for me, that's a big indicator.
So kind of backing up a little bit, to maybe it'd be easier for us to think about what is injury and then what is soreness, right?
Okay, let's start there.
So injury could be when a tissue, whether it be muscle, tendon, ligament, skeletal, fascia, soft tissue. So just think about your body. When your body is overloaded to capacity where it needs longer to repair. Your tissue has reached a capacity where it's gotten to a point where it's like, this is not how it's supposed to function. But in the similarities of that, there is still a level of tissue or like, chemical buildup and tissue damage in both. If you're not injured and you go to the gym and you're doing a bicep curl or you're working on your quads, you are breaking down your muscle. That is literally the point. You break it down and you get stronger through recovery, and then your muscles get bigger and therefore it becomes stronger. That's the normal response. But in that, it literally has to break down. So breaking down isn't the definition of injury. It's when your body can't handle how much it's taking to recover from that.
Yeah, I think that's a good way to put it. There's a lot of ways you can do it or talk about it. Load versus capacity is, I think, a simple analogy. When the load, it doesn't just mean the physical weight, but maybe how much you're doing. Maybe you're sleeping less, that kind of increases load. Anytime that exceeds the capacity of your body to handle any of that, probably going to lead to injury.
Okay. So you think that's a pretty fair, I think it's a pretty fair statement of what injury is, right? Now, going back, piggybacking, soreness. Somebody comes in and they're just describing a million things. What, as clinicians, what is going to be your go-to answer for somebody saying, I have this pain in my leg? We'll just stick to the quad because we're already talking about it. And I don't know what it's from. What are the adjectives that you're going, or how are you asking these guys to give you descriptive points for the type of soreness that they're describing? Does that make sense?
So adjectives could be similar, but I almost look at, because something can be, if something is sharp, probably isn't soreness. Could be, but maybe not. If it's numbing or nervy or, stinging like that, that's probably not soreness, but it could be. I think, but if you hear tight, it's kind of dull, it's hard to describe, that's probably closer to soreness. But I think hearing that and then pairing it, like how we started off, like, what have you done recently? How long has it been going on for? And then if you hear those things, and then maybe not for you as a coach, but as a provider, you assess the tissue and the tissue seems relatively normal, then it's like, okay, this is probably more soreness, But so I think if it's on the sharp, burning, nerve, nummy side, it's probably not as soreness, where dull, achy, diffuse, hard to describe. That could be soreness, and then you compare it to the time domain that they've been feeling it for.
Yeah, I think that's a great way to put it. I think every time that interaction happens, it should be comprehensive. I hate to just give somebody an answer like a diagnosis if I don't even do a even halfway thorough job of just screening, even though this is, a lot of times it's conversation maybe in and out of gym class, right? You're not going to sit down for 30 minutes and do a full eval, but if somebody asks the question, I think we should ask as providers some follow-ups to get those characteristics. And I would agree with Garrett, definitely like the nerve kind of things are probably not soreness. Sharp pains tend to not be. But another characteristic that I'll like to ask about would be any sort of swelling, like if you notice joint soreness or joint swelling. That's not a sign that I would say like, oh yeah, just keep working through that and that'll go away. Mm-hmm. So that's another common characteristic you can use to differentiate soreness versus pain. So just pay attention to all those symptoms.
Mm-hmm. Awesome.
What about you, as you try to help your athletes in the gym or just even your friends, outside, like how would you try to, differentiate?
In a position as a coach in the strength industry, you're looking above and below the joint, right? So that's the first thing, because then what I'm trying to do is strengthen or loosen between those 2 points to help aid in something that could be painful. So again, just going with the lower limb, right? You come in, you're like, my knee hurts. Okay, well, is it really your knee or is your calf super, super tight? Is it your hamstrings that are rock hard like mine are all the time, right? Like you gotta help funnel through all that blood flow to allow for the muscle to recover. So it's more so how can we, again, lengthen rather than tighten at that point. That's the only thing that I'm gonna do. And then if we have to, again, tailor things depending on the day to move things away from that sore or pain driven area, we can do that.
Mm-hmm.
You brought a good point earlier about communication between coach and provider too. Like we need to be on the same page for this person's sake of, what is going on. Because like you said, you're going to see them way more than we will.
Yeah.
So to be able to emphasize the things that they should be doing, maybe tailor back or scale back the things they shouldn't be temporarily, so that soreness doesn't lead into injury or injury doesn't get worse. That piece is critical.
So like, since we're talking about lower extremity, when I think about like a runner, and just like me personally also having runner history, when you're running, there's like a saying like, oh, my knee's talking to me. And you can also say that like about squats or whatever else. But like throughout a run, your knee could feel fine for 3-4 miles. And then you starting to have some aches or pains or sharpness. And, at that moment you're trying to decide, am I injured or is this somehow just, am I overloading it? But if you keep running, that might go away. But I think the acceptance of like, I'm running a lot. I mean, I'm having lots of steps per minute, and now it's 30 minutes, now it's an hour, now it's 2 hours. I think it's okay, like you said, with a mindset, to be like, just acknowledge the pain, saying, my knee's talking to me, and that's okay. And then the pain might subside during the course of that exercise, and then you notice how you recover. Is that gone away? Is it completely fine? Does it happen again the next time you do that activity? And then is it getting worse? Is it staying the same? But I think in the moment when you're feeling something, not to freak out and to think, okay, I'm feeling this and that's okay, and letting go. And then after the fact, breaking it down and figuring out what you got to do from there. And what was that? Just because you feel it right then and there doesn't necessarily mean it is the pain or it's an injury. It could be soreness. That's literally completely normal, just because right now you have too much, TNF alpha, or just want to say fancy chemical.
Yeah, we get it. You're smart.
Yeah,
right?
or something could be just building up that's then processing in the moment, and then there you go, and then you're fine. So.
Yeah.
My final question, all right, because we're already getting pretty close here. What are we going to do? We've kind of talked about it a little bit, but what are we going to do to get rid of the pain or aid in the process of getting rid of the pain? From that standpoint, from your guys' eyes to your clients, how are we going to help them get back to what we need to do on a day-to-day basis?
Yeah, well, kind of piggybacking off where Garrett left off there about, them having a mindset of not necessarily complete negativity, that they can push through it, is important. So I think as a clinician, you need to first try to get as accurate of a diagnosis as possible, because not all things are going to be treated the same way, right? Not all shoulder pain, not all knee pain is the same, but to specifically answer your question, how we're going to do that, again, the diagnosis is step one. Learn, first of all, what you're dealing with. And then secondly, for me, it's about having a conversation with the patient of, let's set up a plan together. I always joke with my patients, you probably don't need me just to count to 10 for you. So that's not like the benefit of working together here. It's let's try to establish, okay, what can you do right now? What can't you do? Let's work around what you can't do. And then let your body kind of heal in the background while you stay moving, so that you're not just feeling like you have to stay home and not engage in these activities. So it's all about that communication.
Love it.
So the question specifically is,
I'm sorry. I don't know what's going on here.
the question specifically is how we're going to get people out of pain.
Sure.
So, I mean, out of all of that, it is very individual and situational specific, but diagnose what's going on, treat the tissue, and then allow time to occur, and then give them tools so that way people don't recreate the same problem, right? And that could mean, more specific technique classes. That could be, being preventative in some kind of maintenance, and actually taking time outside of the gym walls and, in some kind of way with a provider by themselves. It could mean being preventative by actually, you need to actually start taking priority in your sleep. It all depends, but it's, diagnosis, treat the tissue, whatever that tissue is, and then figure out a plan together. How is this going to stop being recreated, and being as preventative as possible? Recently, I've been telling people it's easier to keep people doing what they love versus trying to get them back to doing what they love. So, being that preventative preaching of just like, you're feeling good, great. Let's make sure you continue to feel good. How are we going to do that? Just because you're feeling good, let's try to figure out how can you do that at home. What do you need to do? Go from there.
Yeah. Keep showing up. Pain will subside. That's the biggest thing I think that everybody needs to realize is know the difference between injury, pain, soreness, right? And allow yourself to kind of just move and continue to do what you're doing. Motion is lotion. That's the truth. My grandma, thinking back to last year, she actually had 2 strokes. And after everything was kind of done, one thing that she came to me for is just movement. And the more movement that we did, the better that she felt. Obviously, that was neurological issues and all the things that came around with the stroke itself. Learning how to talk again, crazy. But those things all come into play. Just like keep moving, don't stop moving, because right when you sit down, that's when things are really gonna start to boil into a full-blown injury. I think that's what everybody really needs to know.
Yeah. Maybe the last thing that I want to say is your body can heal. Like, our bodies are built to heal. Like, that's what it's supposed to do. It just sometimes needs the right environment, and creating that right environment is what we're really talking about here. So you can heal. You're not broken. Let's keep moving forward, like you said.
Absolutely.
Any updates coming up? We're going to try to get back on track and not have a hiatus because of weddings and fun and
Too much fun.
life.
Yeah.
I've been talking about the upcoming reps for MS with people today. I talked about being on. I'm gonna post about it. Like, that's coming up in November.
November
Wanna
8th.
talk about that.
Yeah, that's going to be coming up good fun and for a good cause.
T-shirt looks so cool.
It does. I think it showed up pretty cool.
Yeah.
Reps for MS. What that is going to be a organized workout. All proceeds are going to be going towards the MS Society of Wisconsin, as well as the individual that was affected by this chronic disease on their birthday this past year. So it kind of hit home here in the gym. So we're rallying behind this individual and going to make them feel like we're all with them. So go there. 8th of November, that is the date. The more people sign up, we'll figure out how this whole thing is going to go down. With timing wise. I did talk to some of the other sponsors, and I think we might have some people roll with a table or two, just kind of having products and other things that people can talk about and aid and all that good stuff. But yeah, how about you? Anything coming up?
No, reps for MS, that's a big thing right now.
All right. Well, thanks for tuning in to another episode of RMC.
See you next time.